In our last video, we have left certain questions unanswered. What about cancer screening tests? When should someone get tested for hereditary cancers like breast cancers or ovarian cancers? What is the early detection connection between hereditary cancers? Should we do regular testing for this, especially when there is a family history of cancer but no one actually has manifested it yet? So here I am, Dr. Rishi Sharma, talking about why and how often should we consider. Cancer screening tests are recommended for everyone based on their age and health history. Cancers such as breast cancer and ovarian cancer can be cured, even at early stages. However, if detected late or not diagnosed until it has spread to other parts of the body, chances of survival may decrease. The earlier that cancer is detected and diagnosed, the greater the chances of treatment success and a cure. Breast cancers and ovarian cancer and all cancers start in a cell. Cancer caused by inherited mutations typically occur when someone receives an inherited mutation from both parents, called autosomal dominant inheritance. Mutations may also run in families where no one person carries a mutation but several family members have either breast cancer or ovarian cancer, called autosomal recessive inheritance. Cancers with a hereditary link that are caused by mutations in gene other than BRCA1 and BRCA2 may also start early, but in the time between the first signs of cancer and diagnosis tend to be longer. Cancers such as pancreatic cancers, male breast cancer, melanoma, and stomach cancer tend to develop later. Over 80% of women with breast or ovarian cancers have no close relative who had either disease. Women with breast or ovarian cancer whose family members have not been affected by these cancers should follow screening guidelines for women at average risk. Women who do not fall into this group should speak with their doctor about their risk of these diseases for getting it manifested based on their personal and family history, as well as the ages at which to begin and end recommended screening tests. In the general population, women should start annual breast cancer screening at the age of 40 and continue as long as they are in good health. Cervical cancers screening is also recommended starting at the age of 21 and continuing until the age of 65. If you have had these normal tests, or until age 70 if you have had a hysterectomy without removal of your cervix, endocervical tissues. Ovarian cancer may be much less common than breast cancers and harder to detect, but early detection can increase the chance of survival. Cancers with a hereditary link develop earlier than those occurring sporadically, so the doctors recommend beginning ovarian screening between the age of 35 to 40 and every year after that. If someone has an inherited mutation in one of these cancer susceptibility genes, there is a higher lifetime risk of developing cancer. Depending on the gene mutation, cancer screening may start early in life. For example, men with BRCA2 mutation have an increased risk of breast cancer and prostate cancer. So they should discuss these risks with their doctors to determine when to begin screening for these cancers. Cancer screenings are procedures done to detect cancer development early on before a person shows any symptoms of the disease. Cancer that have been detected early on generally have a higher cure rate and a better prognosis. A cancer screening is not a test for cancer. It is designed to find abnormalities that may develop into cancer if left untreated. Cancer often develop very gradually over time and can go undetected until they become more advanced and harder to treat successfully. The earlier your cancer is found, the easier it will be for you to fight it.